Measles cases surged to 33-year high as vaccine rates decline. The United States is facing its largest measles outbreak in over 3 decades, with confirmed cases reaching 1,753 across multiple states. The resurgence of this highly contagious, yet preventable disease is driven by declining vaccination rates and the erosion of community immunity. While the outbreak is not new, the trend is accelerating, raising serious public health concerns. The current situation outbreaks are currently active in multiple regions, including a significant cluster in Utah and Arizona with over 180 cases. Earlier this year, Texas declared an outbreak over in August, but the strain circulating now is believed to originate from that earlier surge. Other recent cases have been confirmed in South Carolina, linked to school exposures, and New York. The CDC reports 45 outbreaks across 41 states in 2025, a dramatic increase from the 16 outbreaks recorded last year. The vast majority, 92% of cases, occur among unvaccinated individuals. Children under 19 represent 66% of those affected, with those under 5 being at the highest risk of severe complications, including hospitalization, affecting roughly 1 in 3 infected children. The role of vaccination rates. Measles was effectively eradicated in the U.S. by 2000 following the widespread adoption of the MMR, measles, mumps, rubella vaccine. Before the vaccine, the U.S. saw 3 to 4 million cases annually in 1963. The vaccine is highly effective, providing lifelong protection for approximately 97% of people who receive 2 doses. However, vaccination rates have fallen to 92.5% nationwide in 2025, below the 95% threshold needed for herd immunity. This decline coincides with increased anti-vaccine sentiment, amplified by public figures who question vaccine safety and efficacy. Health Secretary Robert F. Kennedy Jr., who previously chaired an anti-vaccine nonprofit, has been a vocal critic, even while recently endorsing the MMR vaccine. Consequences and risks. The decline in vaccination coverage means more communities are vulnerable to outbreaks. Measles symptoms typically appear 7–14 days after infection and include fever, cough, runny nose, red eyes, and a spreading rash. Roughly 1 in 4 cases require hospitalization, and 2–3 out of every 1,000 infected individuals die. If sustained measles transmission continues for another month, the U.S. will lose its elimination status as determined by the World Health Organization, a status held for 25 years. Canada recently lost its own elimination status earlier this month. The path forward. The MMR vaccine remains the most effective tool against measles. Even vaccinated individuals who contract the disease typically experience milder symptoms. Parents are urged to ensure their children are up to date on all recommended vaccines, including those for diphtheria, tetanus, pertussis, polio, rubella, and chickenpox. The scientific consensus is clear: vaccinations save lives. Prevention is far more effective than treatment, and the risks associated with measles far outweigh those of vaccination.